Hi everyone. Today we will be talking about the microstructured product Implanon. Implanon is a hormonal contraceptive implant and takes the form of a small rod that is implanted in the arm. It can be used for up to 3 years to prevent pregnancy and does not require daily actions from the user, unlike the birth control pill. The active ingredient in Implanon is progestin etonogestrel, which serves as a contraceptive agent because it inhibits ovulation and increases the viscosity of the cervical mucus. Implanon comes as small rods that are 4 centimeters long and 2 millimeters wide. Shown here is a cross-section of an Implanon rod. The structure consists of a polymer drug matrix core covered in a polymer shell. In the core, the polymer material is ethylene vinyl acetate copolymer, which is 28% vinyl acetate, and is loaded with 68 milligrams of the active ingredient, etonogestrel. The skin, which regulates the release of etonogestrel from the rod, consists also of an EVA copolymer, but with 14% vinyl acetate. The skin is 50 to 250 micrometers in thickness.
The ability of Implanon to only release 25 to 30 micrograms of etonogestrel per day is a very significant property of this product. This release rate is needed to reach a mean etonogestrel concentration of about 150 to 200 picograms per milliliter in the female's body. This is a graph of the average etonogestrel concentration in picograms per milliliter in the body as a function of time. During the first few hours after Implanon is inserted, there is a maximum concentration of etonogestrel reached at around 800 picograms per milliliter, but eventually levels out at around 150 to 200 picograms per milliliter. This number goes down slightly over the course of the 2 years. After removal of Implanon, etonogestrel becomes undetectable in a few days. Here is some more pharmacokinetic data about etonogestrel. It has a half-life of 25 hours, clearance of 7.5 liters per hour, and bioavailability of around 100%. These contribute to the rapid disappearance of etonogestrel from the body after Implanon is removed. So why 150 to 200 picograms per milliliter? This amount of etonogestrel is needed to suppress ovulation, increase the viscosity of cervical mucus, and alter the endometrial lining, which work together to make pregnancy practically impossible. When a woman becomes pregnant, the body releases a high amount of progesterone, which halts ovulation. Specifically, etonogestrel stops the ovulation process by binding to progesterone and estrogen receptors and mimicking the behavior of progesterone.
As stated before, Implanon's core material is embedded in a single rod. The fact that Implanon is a single rod means that compared to its predecessors, it is easier to implant and remove surgically. Its main predecessor, Norplant, was a 6-rod system, and many doctors complained about it being hard to implant and remove. The former, from a pharmacological and physical perspective, is important. If it's too cumbersome to implant, then its insertion is more likely to damage surrounding tissue. In the case of Norplant, its cumbersomeness meant it sometimes led to nerve damage upon insertion. Implanon may have similar problems, the main ones being that it can get stuck in the applicator and not be inserted fully, or that it is inserted too deep and it damages muscle. But the fact that the same functionality exists with just one rod means an increased chance of cleaner insertion. As well, a cleaner insertion means it is more likely to work. Implanon works best when it is placed solely in subdermal tissue, meaning a faulty implantation can affect the bioavailability of the drug in the body, making it less effective. The main property of Implanon, controlled release, is also a property of its structure. The etonogestrel in Implanon is embedded in an EVA matrix, and that matrix is enclosed by an EVA skin. Implanon's EVA skin, having a thickness of 50 to 250 micrometers, regulates the rate at which etonogestrel is released in the body by acting as a barrier to diffusion. More specifically, the vinyl acetate content of the EVA membrane controls the rate of release, and in Implanon, this membrane is 20% vinyl acetate by weight.